Hi. So today, I want to talk about bone marrow donation. If you are in Singapore, so you might come across. Sometimes they will hold road shows in schools or at anywhere parts of Singapore lah. So they will ask you to give a sample. So they will take a sample from your mouth and then they will uh, put it into their database. So recently, I received a call when I was studying in Singapore, uh, calling me to tell me that previously when I was studying there, they took my sample and then now they found that I am a match for someone lah. And then they asked if that am I willing to donate. So I said yes, I'm willing to donate, and unfortunately, due to some of my health reasons, I'm unable to donate lah. So today I just want to talk about this one, bone marrow donation. Okay, once you have given the sample to the database, Singapore's database, it is shared with the whole world. So that means it is shared whole worldwide. So that means any country can access the database. So if you are residing in Singapore, you can give your sample, and then once your sample is in the database, any parts of the world they can access it. And if they find that you are a match, they will call you and contact you lah. So once you are willing to donate, so they will go to the do a workup. That means they will do a body check and so that to ascertain that you are physically fit for the donation lah. Okay. There are now okay, who needs a bone marrow transplant? Those patients that are not producing the right amount of blood cells, including those with leukemia, those that have blood problems lah. So if they have no suitable family donor, they will register lah through the bone marrow donation program lah. So okay, I want to talk about how to donate. Of course, they will go through those after medical checkup, and then those that pass the medical checkup, the doctor will advise you lah. So now there are basically two types of donation. One is the PBSC donation, and one is the traditional operation type to take your bone marrow lah. So today I want to talk more about the PBSC donation because a lot of people not very familiar with this. So the PBSC donation is now the most common method of stem cell collection. It is used almost 90% of the time. It is a non-surgical procedure to collect the blood stem cells from the bloodstream. Okay, so before you go for this PBSC, you will have to receive daily injections of a hormone. It is a kind of hormone which is called the GCSF lah, for 4 days. For 4 days continuously before the donation date, and the 5th injection on the day of your donation. Okay, so the first injection you will receive at the collection center lah, and then they will teach you how to self-administer for the next few days. So during the first dose, right, they will keep you under observation lah for 1 hour to see whether you have any allergy. Then if you are not comfortable, you can also visit a GP and ask them to administer for you. And then you will, on the day of the donation itself, you will reach the hospital in the morning. They will apply the local anesthesia. Okay, and then it will be administered in both arms. So they will put anesthesia at both arms before they insert a sterile needle in each arm. So your blood will be collected from one arm and will pass through a machine that separates the blood stem cells and the remaining blood will be returned to you through the other arm. So this process will go about 5 to 8 hours lah. After which the collected blood stem cells will be sent to the lab to determine if it is enough. So usually it is 1 day is enough lah. So if sometimes it's not enough, they will require you to go for a second day donation. It's very rare lah where 2 days are not enough, and then you have to be asked to go to the traditional bone marrow collection lah. That means the traditional operation one lah. This case is more rare lah. So there are times when the donor's arm is not is not suitable, so they will place a central line placement. This one also will be determined by the doctor lah. The side effects of the PBSC donation is sometimes you will experience headache, bone, muscle aches, fever, soreness at the injection sites. Usually shortly after the donation, they will go away lah. And then sometimes if you require, you can request from the doctor some medication to manage the symptoms lah. And then maybe you will experience some discomfort lah during the donation, like dizziness, nausea, feeling cold, numbness, stinging feeling on your lips, nose and fingers. And after donation, you may have bruising, cramps on your arms. After usually a few days or a few hours, they will go away lah. So generally, within the next few days, you can go back to your routine lah. So the traditional bone marrow donation is the operation one lah. This one is the traditional type. You have to go through a surgical procedure where you go under a general anesthesia, and then you may be asked to check in in the evening before the donation or on the morning, depending on the hospital. And then usually you have to fast for 8 to 10 hours before the donation. So during the procedure, the doctor will collect your liquid marrow through a needle from your pelvic bone with your back facing up. Usually it takes about less than an hour lah. And then after the procedure, you have to stay in overnight so that they can observe you, and then you can go home the next day lah. The side effects usually the same: sore, stiffness, lower back, and then at the end of the donation, you can ask your family or friend to bring you home. So after that, after these two donation, right, you have to follow up lah. Usually, follow up within a year, so to ensure that your health is not affected. And then your donated cells should be replaced within 4 to 6 weeks under normal circumstances. So subsequently, after the donation, you will be reserved for 2 years for the patient you have donated to. So in the event the patient requires a subsequent donation, they will contact you again to see if you are willing to donate again lah. This is the form of therapy in which the lymphocytes, particularly the T cell that is collected from the donor through apheresis, to help the patient manage the disease better. The method is very similar to the PBSC donation, except that you don't have to undergo the GCSF injections. So after 2 years, if you're still willing to be on the register, you'll return to the public register lah. Okay, so that's all for today. I hope if any of you that's willing to donate, you can register yourself at the bone marrow donation program. You can request to give your sample so that they will record your sample in their database, and then this database can be accessible worldwide. So I hope that those of you who are willing to donate can go and check this out, the BMDP program. And then I hope that those of you who will who are willing to donate can please share with your friends and family members about this program, and hopefully more and more people are willing to donate their bone marrow to save lives lah. Okay, thank you. That's all for today.